Today we are going to see the common symptoms of neurological disease. The last class we saw the examination of the nervous system. What are the various problems that can occur in the various parts of the brain and the spinal cord and the peripheral nerves. So today we are going to see the symptoms of neurological disease. The common symptoms that you find in nerve problems are headache. Headache is a common problem. The brain is located in the head, and it is only obvious that whenever there is any neurological problem, there is headache. Then you also get pain in the face. So we'll be studying in detail why pain in the face happens, why headache happens, and why syncope happens. These three things we will be studying in detail. Syncope is a third common symptom of neurological disease, and it is nothing but blackout or faint. You would have seen in school that people suddenly faint, or older people suddenly faint. So that is called syncope. The other common symptoms of neurological disease are loss of vision. See, the cranial nerves, a lot of them connect to the eye. So when they get affected, the person will get loss of vision. Or even if there is cerebral damage. There are, as I told you in previous classes, the cerebrum has a role to play in the movement of the hand or legs and speech, all these things. So if the cerebrum gets damaged, the corresponding area which has a particular function will also be lost. So person can lose the smell of lose the ability to talk, they can lose the ability to move their hands. So all these things can also happen because of neurological problems. So similarly, loss of vision can happen, giddiness can happen, then pain in the arm. You'll be studying something about sciatica, which is pain in the leg, which is referred from the back. See, we have the central nervous system, which is the spinal cord, and the nerve roots come out from the spine and they go to the various periphery. So when there is compression in the spine, the place where the nerves go from the spine, those areas also have pain. That is why you have back pain, pain in the arm, pain in the leg. Then difficulty in walking can be because of complete paralysis of muscles, or it can be because of paralysis. Paralysis means partial paralysis or partial loss of muscle power. That's called paralysis. Then you also get movement disorder. We already studied about cerebellar control of the human body. Cerebellum controls the equilibrium or the stability of the human body. So when people have cerebellar lesions, they have instability, ataxia is present, they do not walk normally. So movement disorders can be present, and in any nervous system disorder there can be decline in memory, problems of intellect, and problems of behavior. So these are the common symptoms of neurological disease. So let us see three things in detail: the headache, syncope, and pain in the face. So the first thing is headache. We all have gone through phases where we have suffered from headache, and our family members have complained of headache. See, headache can be due to different reasons. Something as simple as lack of sleep or stress can cause headache, and something as serious as a head injury or intracranial bleed can lead to headaches. So we have to identify what kind of headache it is, how long it is present, and what happens because of the headache. So based on that, we'll have to treat the headache. So headache is very common in a neurologist's clinic, because a lot of people who suffer headache, if it is chronic or if it is acute but very severe, then they go to the doctor. If it is acute but not very severe, usually people ignore it. They use self-medication or they use other methods of treating it. But usually when there is severe problem, they go to the clinician. Let us see the causes of headaches. Acute headache can be caused because of subarachnoid hemorrhage or intracerebral hemorrhage. These are serious problems. Hemorrhage is bleeding in the brain. Hemorrhage is bleeding actually, and when it occurs in the subarachnoid space and intracerebral space, then it can be very serious. It is usually after a trauma like accident or anything, or it could be because of a break in the aneurysm, bursting, or things like that. The other causes of acute headache are migraine, meningitis, encephalitis, and sudden rise in intracranial pressure. It can also be due to infections, septicemia. Okay, it can also be used with drugs like alcohol use, then due to hangover. These are common causes of acute headache. Then the subacute headache. Subacute, that could be because of raised intracranial pressure, any abscess, any empyema or pus present in the subdural space. It could be because of tumor, hydrocephalus, subdural hematoma. All these things can cause uh, subacute headache. There can be chronic headache, that is persistent tension type of headache. Could be due to psychological problems where patients suffer from depression, anxiety, then post-traumatic, intermittent migraine kind of headache, tension headache. These are all chronic types of headache. Then there are referred headaches. Okay, so referred headache means the problem is not in the head, but it is referred because of some other problem somewhere else, due to strain to the eyes, due to sinusitis, toothache, and neck pain. They can be referred to the head and cause headache. So let us see first the acute headache. Acute means it is sudden onset, okay, and it has happened for a very short time. And most of the patients who suffer from acute headache could be having subarachnoid hemorrhage. Okay, if it is a very severe type of headache, it's a dramatic, explosive. See, just because it's acute, mild headaches are not considered to be subarachnoid hemorrhage. Okay, usually aneurysm or angioma present, which can break, leading to a sudden, dramatic, explosive onset of devastating headache. This means the person is normal and suddenly there is a very high intensity splitting headache. Okay, that severity, that tells that there's something seriously wrong with the person. And they can also have neck stiffness, and the patients with subarachnoid hemorrhage can lose consciousness and have other neurological symptoms. So these kind of patients have to be rushed to the hospital. They need to undergo emergency treatment, and they people who have vomiting associated with headache, such kind of severe headache and loss of consciousness, they may be hypertensive also, and it may be due to hypertension. So either a stroke can be occurring, or it could be because of any other aneurysm. So they have to have a CT scan taken, and within the first 48 hours itself, treatment has to be started. In fact, within the first 6 hours itself, treatment is started as early as possible. Okay, so how do we differentiate it from other kinds of headaches? See, migraine also occurs suddenly. Though it's a chronic condition, it can occur suddenly, but it does not occur within a few seconds. It takes a few minutes or few hours till it becomes very severe and sharp. But a subarachnoid bleed is very sudden. Okay, it's so sudden that you will not expect that a person can have such kind of headache. And these kind of patients may have the people with migraine may have neck stiffness and photophobia and all those things, but if they undergo a CT brain, there will be no abnormality. The CSF, cerebrospinal fluid, will have no abnormality. So that differentiates from migraine and other headaches. And migraine, those with migraine usually have it repeatedly. Okay, so that is how we differentiate between person having migraine and acute headache due to intracranial bleed. So let's see what is subacute headache. Subacute is headache which has been present for a few weeks or months. Okay, and any headache should be taken seriously. And subacute headache also can be due to some serious problems. One of the common reasons for subacute headache is the intracranial pressure increase. Okay, intracranial pressure can increase when there is tumor, when there is hematoma in the subdural space, hydrocephalus, So these are common reasons for intracranial pressure. There are a lot of other conditions as well where you can have raised intracranial pressure. And sometimes when a person coughs or sneezes, bends or strains at the toilet, all of these can raise the intracranial pressure. And one common symptom which can accompany the headache caused by raised intracranial pressure is the vomiting, and that too effortless vomiting. That is, it just vomit just comes out. Okay, they don't retch, they don't bring it out, it just comes out on its own. So that can be cause of raised intracranial pressure due to some lesion in the brain. So this is a cause of subacute headache. It's not very severe and it's not something which happens instantly, but it is present for a longer period of time, and so it's always better to go to the neurologist and have a checkup done, especially if the person has effortless vomiting accompanied with the headache. Then the chronic headache. There are two main reasons for chronic headache. The first common reason is the migraine, and that's what we're going to study in detail. Whenever a person has a long period of headache, sometimes they have even for 3 years, okay, one of the main reasons is migraine. So migraine starts, the onset of migraine is usually with something called as the aura. So they have a precursor, like before it happens, they feel some feeling of difference from a normal position. Okay, and they will feel as if lights are flashing in their head, and they will feel a little dizziness, something ringing in the ears. That kind of feeling they will have. The cause of migraine is that it's a neurovascular disorder. Neurovascular means it's a nervous system disorder plus a vascular disorder. And a lot of people have studied why and how this migraine starts, but very little is known about the cause of migraine. I mean the exact cause, though we know the triggers for each person. So genetic factors may be involved in the migraine, but the mechanism is that there is vasodilation, okay, and that leads to a neurogenic response in the meninges. Meninges are the covering of the brain, and this leads to headache, severe headache. What are the triggers for migraine? There are several triggers for migraine. Stress is one trigger, fatigue, intolerance, certain foods, certain lights, certain situations, okay, certain sounds. All these can be triggers for migraine. If people touch a particular area of the head, each person who suffers from migraine will have a different trigger. So whenever that thing happens, then they will get the migraine. So some people, when they get stressed, they will say I'm starting to have a headache, and then a particular kind of stress they will have severe headache. Some people, if they see lights, bright lights in their face, then they will get migraine. Okay, so there are different types of migraine. Retinal migraine, okay, retinal migraine, as the name indicates, retina is in the eye. Okay, so due to spreading depression of the retina, they may have retinal migraine. Just like status epilepticus, status asthmaticus, we have status migrainosus, where the migraine lasts for 72 hours. It's a quite a long time. 3 days the person will suffer from severe headache, and they can also have the aura period, the precursor to the migraine, that can last for more than a week. Okay, so chronic migraine usually lasts for more than 3 months, and one of the best methods in which it can be controlled is with the use of analgesics. Okay, you can have analgesics, pain relief drugs can be given, and that can help to reduce the migraine to a certain extent. It cannot be completely overcome. The other treatment for migraine is that they can usually take antiemetic, okay, and that will help to reduce. And a person can also take paracetamol 1000 mg, or any non-steroidal anti-inflammatory drugs can be given to the person. And headache can also occur due to the other causes of headache other than migraine, other than subarachnoid hemorrhage and other than intracranial pressure, there can be headache due to other reasons. The headache can be due to uncorrected refractive errors. When there are problems in the eye, the person can have headache. So this kind of headache, the onset occurs after watching TV, reading for a long time, or if they strain their eye for a long time, and it can be treated with analgesics. There are other reasons of headache, like a person who has high blood pressure, they can also have headache. So like that, there are other reasons as well, but they are not very severe serious problems. Hypertension, if there is increased if there is a bleed in the brain because of hypertension, that can be a serious problem. Okay, hypertension can lead to stroke also. So stroke is nothing but ischemia in the brain or hemorrhage in the brain. So that can become a serious problem. But mild headache because of just increased hypertension, you have to control the hypertension to relieve the headache. That will help in overcoming the headache. The next topic that we are going to see is facial pain. This is another neurological symptom. There are three reasons why a person, there are many reasons actually. Three common reasons why a person gets facial pain is trigeminal neuralgia. Okay, trigeminal nerve is one of the cranial nerves. Okay, optic, olfactory, oculomotor, trochlear, and trigeminal. That is a fifth cranial nerve. So what happens in the cranial nerve is that people who are above the age of 50, they can have severe pain in the face. Okay, and this kind of pain is like a sharp shooting pain. It's like an electrical pain. If you have had an electric shock, you will know, you will understand what it means. Okay, it will be a sharp pain. Usually nerve pains are sharp in nature, and orthopedic pains are dull throbbing pains. Okay, so here the person will have sharp pain, usually on one side of the face. Sometimes they can get in both sides as well. And this kind of pain occurs when a person is speaking or eating, and when they touch a particular part of the face. For example, if they touch near the nose or any other place, they may get this sharp pain. This is due to trigeminal neuralgia. And a lot of people, to prevent this pain from occurring, from getting triggered, they stop washing their face or they stop shaving. So these are some methods in which people try to treat themselves. But carbamazepine is one of the methods of treating. Baclofenol can also be given among other drugs to overcome this trigeminal neuralgia. The next reason is trigeminal neuropathy. Okay, it is not trigeminal neuralgia itself, it's trigeminal neuropathy. And here again, the pain can be increased because of touching, but it occurs without a trigger. There is no trigger, but it occurs on its own. And the one important aspect of trigeminal neuropathy is that sensation can also be lost. Loss of sensation in the affected area can be present in trigeminal neuropathy, whereas in trigeminal neuralgia, sensory loss is not present. Okay, so the reason for trigeminal neuropathy is usually post-herpetic. Okay, after an attack of herpes, the person can suffer from post-herpetic neuropathy. The third cause of facial pain is glossopharyngeal neuralgia. Glossopharyngeal nerve is another of the cranial nerves, and here this pain is localized to one side of the face, usually at the back of the throat, and it radiates from that place to the ear. And usually glossopharyngeal neuralgia is triggered when a person swallows food or when the person sticks the tongue out. So these are common triggers for this glossopharyngeal neuralgia, and these are the common types of facial pain. Okay, so as in any other pain, we can treat the pain with non-steroidal anti-inflammatory drugs as a first stage, and then further management can be done. We will see syncope in the next class. Syncope is nothing but loss of consciousness. There are different types of syncope, so we will see that in the next class. Okay, thank you.